Founder and CEO of Cosmotive, a Rwandan social enterprise that was created in 2014 with the goal of improving maternal and child health in Rwanda and throughout Africa. Blandine will tell us about Cosmo Health App. Yes, please, if you, sorry, 1 second. If you guys are okay with it, you can record it. I mean, the participants have agreed, so thank you for recording. Let me say again, the second presenter is Blandine Umuziranenge, founder and CEO of Cosmotive, a Rwandan social enterprise that was created in 2014 with the goal of improving maternal and child health in Rwanda and throughout Africa. Blandine will tell us about the Cosmo Health App, which is one of the many projects of Cosmotive. Next, you will hear from Vinicius Lopez. He is the coordinator of Pupusapp, which is a project of Data Labe, a Brazilian organization that works to empower and uplift people living in the favelas of Rio de Janeiro through data journalism and narrative storytelling. Pupusapp uses WhatsApp to collect citizen-generated data on sanitation in the Mare. Last but not least, you will hear from Lisbeth Kageni, who's a senior researcher at the University of Nairobi, and she's the team lead for the Radha app, a mobile health application developed by students that addresses issues concerning student health and well-being and connects them to support services through the University of Nairobi. I will let my colleague Tole Nyata, who's also an Internews pandemic mentor and an experienced media trainer and facilitator, facilitate this webinar for us, and he's assisted by my colleague, Catherine Clearly, who is the part of the HJN, the Health Journalism Network team. Over to you, Tole, and thank you everyone for joining us this morning.
Thank you very much, Bear. Welcome everybody, and thank you for taking your time and joining this very interesting discussion where members of the HJN are going to showcase some of the good work they've been doing and the impact it has had. So before I continue, kindly join the HJN network. Michael will throw the link in the chat. The network is a front row seat for opportunities and trainings and interactions like the one we are having today. So without further ado, I'd like to introduce our first panelist for today, Aina Bat. The floor is yours. Thank you.
Hi, everyone. I'm Aina Bat. Thank you, Tole and Bear, for your kind introduction and for inviting me to join this interesting panel. Can you hear me? Hello?
Yes, we can.
Yes, okay, thank you.
Yes, we can.
So SAGLIC, which means Health in Turkmen, turned 10 last year, and we work at SAGLIC to improve public health literacy in Turkmenistan. At the moment, saglic.org is the only platform that provides credible public health information in the Turkmen language. So as it is, is my slide show on? I can't see it, the slides. Okay,
yes,
thank you.
There.
Thank you. So as you can see, as we try to reflect it in our logo, we are concerned with the health of family, which is a significant, a big value in Turkmen society. We're concerned with the health of family, community, and environment in Turkmenistan. The issues we raise and cover at saglic.org might be the only content available to a Turkmen speaker on the internet. So we develop a lot of content, and so far we have about 2,000 articles on public health issues, including translation of several public health books and health pamphlets. Over the last year, as Bear mentioned in her introduction, we turned into a comprehensive source of science-based COVID information in the Turkmen language. As some of you might know, Turkmenistan is one of the few countries in the world that has not reported any COVID cases. any COVID infection in the country. So SAGLIC is one of the few sources of science-based information on COVID at the moment, and it benefits the public in Turkmenistan. Next slide, please. Just to provide some background information, after the breakup of Soviet Union, Turkmenistan emerged as an independent country. It has a population of about 6 million people. In terms of access to information, it's very, very hard to access information in Turkmenistan. I would characterize the state of the internet in Turkmenistan as a on and off internet blockade involving complete internet shutdowns and targeting and blocking specific websites and platforms by the government in Turkmenistan. But it's not just internet. There are only 300 books get published yearly in my native language in the country, and computer literacy is very low. For many youth in Turkmenistan, internet is just Instagram and YouTube, where there is a Turkmen community, and these platforms they can only access with VPNs. So I try to capture on this slide to give you an idea. As I said, the population of Turkmenistan is about 6 million people, and there's no government statistics on access to internet in Turkmenistan. So I'm using an alternative independent source here. So these are the numbers, but also it's not just statistics. It also concerns the statistics, health statistics in Turkmenistan. There's the data is just not available. Next slide, please. So at SAGLIC, we develop a new language of constructive language of engagement around many issues, including culturally taboo topics. So if you are a Turkmen young man or woman, and if you want to learn about sexuality, reproductive health, and sexual health in your language, in Turkmen language, our website would be the only place you can access unbiased, medically correct information. There are no other sources. In terms of culture, Turkmen people have been deeply traumatized by years of repression. This means that, what does it mean? I thought about the ways to describe it in such a short presentation. This means that structural violence deeply impacts not only the physical health of Turkmen people, but also their psychological and mental health. It manifests itself by the high levels of depression and suicide rates among youth in Turkmenistan. One can observe a culture of learned helplessness, doublethink, and preference falsification in public discourse. These are the psychological states of mind we're encountering in our work. Next slide, please.
Excuse me, Ainaba. Excuse me. There's a request that you slow down a bit. You speaking a bit too fast for some folks. Sorry about that.
No, sorry. Yes, I know that I do speak very fast. Thank you. I'll slow down. Well, I won't go back, but please feel free to. I'm trying to pack a lot of information. Sorry. I will be happy to. I'll be happy to address questions afterwards. So sure. I'm moving to our Bilim app. It's one of our new products that we launched. It's a period tracker in Turkmen, the first and only one for now. We launched it last year in June. Depending on where you put the stress on the word bilim, it might mean knowledge of period in Turkmen. So we decided to combine them and develop an app using our existing materials at SAGLIC on reproductive and sexual health. We got inspired by our colleagues, by our Iranian colleagues, who developed Hamdam app. It's also a period tracker app in Farsi. We learned a lot from them, from their experience. So it was truly an international effort to develop this app and make it available to the public in Turkmenistan. Bilim provides a Turkmen speaker with information about menstrual cycle and also general information about sexual and reproductive health, which are not discussed in Turkmen, and also women's rights. So as I mentioned earlier, Turkmenistan has been independent for the past 30 years, and there is a significant women's rights backsliding in the country, such as diminished educational and employment opportunities, deterioration of health indicators, and access to medical services. In public square, Turkmen women's role has been diminished to the role of a wife and mother. And just to give you some background information, child mortality rate is the highest in the region, in Central Asia region. And the recent changes, not so recent, about 3 years ago, the gestational age for abortion in Turkmenistan has been changed from 12 weeks to 5 weeks. So with this, I hope I provided some background information about Turkmenistan. It doesn't make any headline news, international headline news. So not a lot of people. I'm aware that not a lot of people read or think about Turkmenistan on a daily basis. So thank you so much. I will stop here. I hope I got my 10 minutes. So, but I'll be happy to answer any questions. Thank you.
Thank you very much, Ainabet. We will have a plenary session where we will be taking questions. But as the conversation is going on, we encourage all participants who have questions to drop their questions in the chat function, and they'll be picked up, and we'll make sure all the queries and questions are answered before the end of the session. So we're moving along swiftly to Blandine. Hi, Blandine. There's one quote I got from you that stuck. You were making a presentation and you said no woman should lose a life while giving a life. That stuck.
Yeah.
So tell us about Cosmo Health.
Thank you so much. I'm Blandine from Rwanda. I want to tell you about Cosmo Health. It's a mobile resource for safe pregnancy and safe birth. As you said, I started this because I really believe that no woman should lose a life while giving a life. So next slide, please. Next slide, please. Okay, thank you. I started, Cosmo Health is a project of Cosmo that I started in 2014 when I was graduating from my university, and my background was in ICT and business, and my work experience was in media. So this time I wanted to do something that I was really passionate about, and this was saving lives. And my background wasn't in health, it wasn't in medical, but I knew I could use the power of information to improve the health of the Rwandan people. So that's the time I looked around. This time we had 38% of starting late. And this, of course, it needed to be, to have a progress in one way or another to be reduced. And on the other hand, the maternal mortality relation in Rwanda was more than 210 per 100,000 live births. And with this, though the skilled birth attendance was really high, but the coverage of the completed 4 antenatal care visits was still low at 44%. So this time I was just trying to see what can increase this attendance at least so that women can go to, for their 4 visits to see if it can reduce the maternal mortality. And that's the time I started the Cosmos magazine. I was publishing about maternal and child health and all about parenting and everything that the mother could need to know when they're pregnant and when breastfeeding. And from there, I wasn't reaching enough of the women who could need this information because of the barriers in like printing and distributing a copy. So that's the time I started Cosmo Health App. So with the Cosmos magazine and the Cosmo Health App, we are digitally increasing access to maternal and child health information. But from there, still, we had these other women who don't have access to all the digital information, the ones who can't not read, and the ones who need really to listen to be able to know what we are talking, like what we want them to understand. So that's the time I started another safe space for women who come and learn to make clothing for the same demographics that we are serving, clothing for pregnant women and clothing for breastfeeding moms, and also making reusable sanitary pads, trying to stay in the same lane, but also for them to learn about the maternal and child health information that we keep in the app. They also get this in the safe space. Next slide, please. So more about the Cosmo Health app. It's a mobile app. Now it's on Android. You get it from Android, and from there, the woman can register their week of pregnancy. So when they register their week of pregnancy, like example on this screenshot, she had like week 4, because when they don't know their week of pregnancy, it comes like week 4 by default, because that's the first time someone can know at least I got pregnant. So from there, they start receiving push notification customized on their week of pregnancy. When it's 4 or 5 or 6, until they are like last week, they keep getting updated messages 3 times a week. The first is about their health, the second is about the baby, the third is about nutrition. So for everyone who uses the Cosmo Health app, the common benefit that they see is that they are equipped with the health advice related to their week of pregnancy, and also it includes access to reproductive, maternal and child health information, and also the products, because we keep updating all the information that we update on our web in the news feed of the app. Next slide, please. With the app, we were reaching the women who have smartphones, but we still had this barrier to access to information for women due to a gender divide, the gender digital divide that still exists here. And this is mostly because of the lack of education for women, the skills and technology literacy, the gender biases, the social cultural norms, the domestic responsibilities that is really heavy for women than men, and also the self-confidence that is low, and all that anxiety about using digital tools that women are facing. And really, in general, this illiteracy is important obstacle for women and girls to access digital information. So next slide, please. From this, from finding out that we have, yes, the app, but we still have this digital divide, we had this from the grant from the Information Saved Lives. That's the time last year we started bringing out now the Cosmo Health Helpline. For those women who don't have access to digital platforms, now to use any phone that they can get, calling on our toll-free number and having our health personnel to get their issue that they want to talk about, and all the information that they need to know. Mostly it's about pregnant women and also adolescent girls, because now we got a component on reproductive health. Those are the ones who used to call and they get all the information they need as they speak with our personnel. So from there, we started this helpline alongside the app. And next slide, please. Both the app and the helpline, and also the community outreaches that we use to have, those are all the components of our ways of reaching and disseminating the information that we have about health. So we use the Cosmo Health live chat. Everyone can ask their question and get the answer from our health personnel. We also use the Cosmo Health helpline when they call and get all the advice from the helpline advisor, if I can call her that way, and also from the outreach when we visit them, whether it's the reproductive health outreach or the maternal health outreach. We go there, we speak with them, we get all the situation that they have, and also kind of case studies that they are now having this time. And that's where we get all the status of the issue that we can write about and what we can now publish in the new blogs or in the information that we customize on the app. We also have an online health forum on our platform, and also for the app, we have it with a customized content that doesn't change, but with the news feed, they get different new updates about like what's going on and other issues that are coming from there. The next slide, please. So when we talk about using the app and also the helpline, now our potential audience is 4,500,000 women in Rwanda, because those are the ones who can have access to phones, whether it's their own phone or a phone in their household, according to the numbers that we got last year. Next slide, please. So our progress to date, we have an active user base of 3,081 users. And if I can quote like two of them, Alice said, with Cosmo Health, I no longer have to go back to the clinic to ask about what to do when I forget about what they told me in my previous antenatal care visit. And last year, by the end, when we were also closing our study, another one called Clistel said, I used to struggle with my nutrition when pregnant and what I can eat when I'm breastfeeding. But from the time I started using Cosmo Health, my visits get easier and better with my weight. So those are the two quotes from our past users. And I really thank all the organizations that supported us up to date. And I can go to the next slide again. So our vision with Cosmo Health is a world where every girl and every woman has access to reproductive health information, and where every parent has access to maternal and child health information and services. Last slide, please. So this is my team, or the team of Cosmo Health in general. And my tips to other health journalists or health communicators about what I have learned in taking this project on is I caught, it's anonymous, I don't remember who said this, but if you're doing the work you love, you will want to seek out opportunities for growth. You will want to get better and better. And the more growth and knowledge you gain, the more success will come your way. Thank you very much.
Thank you very much, Blendin, for the fantastic work you're doing. I have interacted with Cosmos, and I like the work and the impact that you folks have down in the community. Now, we are moving on to our third panelist of the day. Mr. Vinicius. When we hear Brazil and the favelas, is usually the stories that we hear in the media, which are not usually very positive. But you've come up with a fantastic project, which is doing awesome work in the favelas, Vinicius. Tell us about Datalabe.
Hello, everyone. It's a pleasure to be joining here today and to present an overview of what we've been doing on Pupusapp. I'm Vinicius. I coordinate Pupusapp. In English, it would be something like Pupusapp from WhatsApp, the message app, which is a project from Data Lab on data generation, environmental education, citizen monitoring, and advocacy on basic sanitation in Complexo da Maré, which is one of the biggest favelas in Rio de Janeiro, in Brazil. So in my presentation, I'll make like a broad review of Data Lab's work, and then I'll head straight to Pupusapp project itself and try to cover all of the aspects and results we've been having so far. So Data Lab aims to foment data journalism and citizen-generated data with a focus on diversity and knowledge production, and we are based in Complexo da Maré in Rio de Janeiro. And it focuses on the narratives of Favela da Maré. And our team is mainly made out of young people who live in the suburbs of Rio and make narratives and stories from and about these places. And one of the main goals of Data Lab is to produce data and narratives about and from the suburbs of Brazil while making interceptions alongside gender, LGBTQ rights, citizenship, territory, and environmental justice. And although our headquarters is located in Maré, we don't necessarily write only about this specific territory, but we pay like a closer attention to the questions involving Maré. So Maré is a favela in Rio de Janeiro with something around 140,000 inhabitants, so it's big. And in Brazil, 100 million people don't have access to sanitation, and 35 million people don't have access to clean water. And as I've said, one of the fronts we act on is environmental justice, and from that comes Pupusapp. Next slide, please. Next, please. So I'll keep going. So Pupusapp started as a side project of Data Lab, and in the beginning, the goals were to produce data about basic sanitation needs in Maré, because even though we're talking about a place with like 140,000 inhabitants, there is a lack of data about these favelas and its people. And one of the main reasons for that is because the responsible agency for making statistics in Brazil doesn't go in the favelas like Maré due to safety reasons, lack of technology, or any other reason they normally come up with. And instead, they try to calculate it like from above. So it ends up not resulting in realistic data. And that being said, we see that there aren't like trustworthy official data on sanitation in Maré. So Pupusapp begins aiming to produce data about sanitation. And how would you do that? We would get a WhatsApp number, go out in the streets and tell people that if they see any problem regarding to sanitation, they would take a picture and send it back to us. And these problems could be like garbage on the street, blocked drains or manholes, open sewers, floods, water unavailability, or anything like that. And after that, we'd ask them to tell us like where they saw it, and then we'd have the pictures, the location, and the time frame. And this is how we would start to produce data. And this data we normally goes on our database, and our data team encrypts it, so it's all safe and no data from the people is like exposed. And yeah, in the beginning, it was a bit hard to persuade people to do it because there was a problem with expectations. We'd tell them to do this, take the picture, report it back to us, and they at first believed that we ourselves would go there and fix the problem. And later we understood that we had to make it clear to them that this wasn't our duty. We wanted to have this data so that we could reclaim public policies to the agencies that had to fix these problems. And little by little, we got them to understand what our job was, and we got to spread the word of Pupusapp around. And besides producing data, we work with environmental education, advocacy, and political incidents. And that's one of the main uses we do of the data we collect. Next slide, please. So, on early 2019, we had our first basic sanitation meeting of Maré, and our main goal on this meeting was to collectively come up with proposals on matter of public policies regarding to sanitation needs in Maré. And we had like roundtables with political activists and people who lives in Maré or experiences Maré in some way. And we would discuss how the lack of sanitation structures affects people's lives and helps to proliferate diseases. And now we see clearer than ever how this is true with COVID and sanitation and this relation with public health. And we ended up this experience with some good results because in a partnership with other environmental collectives like pre-existent environmental collectives in Maré, we got to replant an area. And this was like a matter of social environmental incidents. And we also collectively made a policy briefing on sanitation needs in Maré. Next, please. On the second, I'm hearing myself. I don't know, but yeah. On the second and third basic sanitation meeting of Maré, we aimed to update the policy briefing that we've made on the first meeting and intensify the political debates and discussions on sanitation matters in Maré. And also, we were like trying to get going with a more political agenda alongside the environmental collectives of Maré. And it happened on June and October 2020. And we got together up around 30 people from 5 different collectives and discuss environmental and sanitation matters, giving all of them time to speak and expose their considerations, as well as saying what they thought it was good at the moment that we should like debate or discuss. And as a result, we got to have public participation and advocate with the responsible agencies for sanitation in Rio. And we also open launched our policy letter on sanitation, which is this green one that you were seeing. And from that, we also got to make a course on alternative technologies on sanitation in a partnership with the Federal University of Rio de Janeiro, which had like 40 participants and got to discuss strategies and alternative technologies to get a better sanitation in Maré. And yeah, it was very nice because there were people from all over Brazil and not necessarily only from Maré or its whereabouts. So we got to have a lot of perspectives on this thing. So next, please. Still one of the last. So here's our next steps, what to expect in the coming months. Now we're planning our 4th meeting, which is planning to happen on the next month, and we aim to discuss solid waste in Maré because it's a very demanded question in our debates, and we're trying to gather up with the residents on the virtual life, which has been our main challenge in the pandemic. And also our goals for later this year is to improve our local mobilization and political incidents because, again, due to COVID, our presence in the streets and forums has been severely affected. And we've seen that this is very important because getting the word around by word of mouth is the most effective for us. And yeah, that's it. I'd encourage you all to follow us on social media so you can see what we've been doing and how we've been expanding our work. And feel free to get in touch. On the last slide, there is our email and all infos you might want to have. Thanks.
Thank you, Vinicius. Thank you for the good work. There are questions for all the panelists that will be fielded by my colleague Catherine after this final presentation by Lisbeth. Lisbeth, I see the name Radha, and this seems like Shen, the language that the youth in Kenyan urban centers use. Is that where you came up with the name for your app from? Tell us about the app, please.
Radha is generally used by young people to mean, is a slang word that is used to mean beware or be alert. So the students were telling the fellow young people to be aware of the health issues that are affecting them while they're in campus, while they are learning. So we are working in close partnership with Sexual and Reproductive Health Alliance and UNESCO as the lead partner. Next slide. Yes, this is a mobile application. When you open your mobile phone, that is what you will see. And the students say they want to look at their well-being as their concern, and it focuses on sexual and reproductive health, HIV and AIDS, general health, substance abuse, mental health, and then career and financial management. Next slide, please. Now, Kenya's population is approximately 50 million. And out of the 50 million, 8 million are young people between 15 to 24 years. And of these 8 million, 2.3% are living with HIV and AIDS. Now, recent studies have also shown that every year we have 17,000 plus new infections of HIV AIDS among the young people. Recently, we undertook a study that was targeting 1,000 university students around Nairobi, which is our capital city. And from the studies, we realized that 1 in 2 female and 1 in 4 male students had been sexually assaulted while in campus. So we are saying, why are we using mobile smartphones? Because again, in the University of Nairobi, in a study that we undertook, 90% of the students reported possessing a smartphone. Next slide, please. Now, initially we had began with the Android version. Then after some time we upgraded, and now we had version 2 that was also on iOS or on Apple phones. Next slide, please. I want to demonstrate the features in the mobile application. This was entirely designed by the students, and because it was a University of Nairobi application, again we said we have to validate who is accessing this information, and the target was for university students to access. So you have to use your email address and the password to log in. The password will be used to validate whether you are a student or you are not a student. So once you log in, there is the first phase. You will see information, the counselors, you will see the notifications, the forum, and then the mentorship forum, and also the help icon. After the help icon, now you can choose what information you want to access. Like now, if you want to look at the information, then on the news feed, mainly we have the news on COVID-19, because that is what is really affecting Kenyans. It's really traumatizing us of late. So most of the information you get on the news feed is more on COVID-19. And then if you want to get information on substance and drug abuse, sexual and reproductive health, you just scroll down and you'll get all the information, even on relationships, on campus pregnancies, and even nutrition, and so on and so forth. Next slide, please. Now, when you click on the information tab, you'll get all the information. Again, the students are saying they don't want to read so much of literature. They want to be disrupted by images of students who are in campus. And like now, in my first image, you will see those are images on relationships. There's information on campus relationships. We are trying to define what is what relationship, what are the meanings of our, like a one-night stand relationship. There's a boyfriend-girlfriend relationship. We also have relationship with the older generations, the older men or the older women, and we have defined them on the application. Then the next slide is on information on GBV. Yes, so again, these are counseling services and they are live. You choose which counselor you want to talk to as a student. The counselors are rated so that you can see who was rated best, and they are also given the expertise on what they are very good at. So you can choose to do one-on-one counseling, or you can also choose to do a group counseling. Next slide, please. So the students again also said sometimes they would want to talk to themselves, they would want to give ideas to themselves, and then that is when they decided to come up with student forums so that they could be discussing issues that affect young people without even the older generation coming to realize. Now, like now what I have there is on financial management. And we realize that sometimes students have a lot of problem in managing even their finances. While in campus, they go broke, and that's why they end up in wrong relationships while looking for money. So sometimes they're also disturbed so much by mental health issues, and they would want to exchange ideas among themselves on how they are able to solve their problems while in campus. Next slide, please. Yes. Again, when we came to counseling, the students also decided that they would need mentorship at personal level, and this mentorship can be on even career guidance, motivational talks. They would need mentorship on how to manage themselves while in campus. So again, depending on what service you want to be mentored on, you register. We want to see which year of study you are in. You also be able to select the mentors. Mentors can be either staff members or student mentors who have been trained. And then once you click on the mentor that you want, the application is able to show you whether the person that you have chosen to talk to is online and is a person accepting more people or has enough people to mentor at that particular time when you want to be mentored. Next slide, please. Those are additional services. If you want to get to direct to a counseling service, or if you want to an helpline, you can click there and you'll get. You can also choose to talk to the bot and it will give you more and more information. Let's move. Next slide, please. Yeah, so we have been able to, after the launch in 2019, we were able to do so much. We attended conferences. We also were able to luckily get rapid relief funds from Internews. And now we have been able also to update Radha, depending on the feedback that we are able to get. Next slide, please. Yes, we have a vision of rolling out the application to all the University of Nairobi students, to scale it up to other universities in Kenya, and also to profile students' experiences, and we're hoping to get partner support. Next slide. Yes, these are students' testimonials who are encouraging each other to use the application because it has all the information that is affecting them while they are in the environment of study. Next slide. This was during the launch, and on the right side, you are able to visit the students in one university, Pwani University. They interacted, and the students in other universities are really taking up the application. On the left side, the regional director for UNESCO was the main guest when we were launching the application. That is her, the lady there, Madam Ndong Jata. Next slide. Yes, these are the students who are demonstrating to the university deputy vice chancellor on how to access the Radha application and on how to get information also from it in conjunction with other colleagues. Yes, I welcome questions and thank you very much for the opportunity.
Thank you very much, Lisbeth.
Yes.
And I'd like to thank all the panelists. For the next session of Q&A, Catherine, my colleague, was tracking the questions and will be fielding them to the panelists. Catherine.
Thank you so much, Tole. Thank you so much to all of our speakers today. Amazing and inspiring work. We have about 10 minutes, so we're going to start with one question per speaker just to start. The first question for Anyabat. Do users have access to special forums through the app where they can converse and interact with one another? And do you have any data on the number of downloads and the level of engagement?
Yes, thank you, Catherine. We have about 1,500 users. We launched the app last year in June. So we do not have the feature for to create platforms for interaction between the users. We are operating. This is something new for the whole country. So we are learning about the app and information about users, although we do not collect any personal information. So when people use it, some of the users use the app offline due to the poor internet access to internet in Turkmenistan. So, but this is something that we're looking into to grow this app. Perhaps that lies in the future. We might look into that, but currently we do not have that. Considering the situation on the ground, issues concerning confidentiality and privacy of users. Thank you.
Thank you so much, Anyabat. For Blandine with Cosmo Health, Blandine, is the app free to download, and how have you been promoting the app?
Thank you, Catherine. Yes, the app is free to download. And we have been, the first time we promoted the app on our social media and also our community, where we used to interact with people. And we also promote the app when we have different community outreach. So far, we have been promoting it that way and also on our website.
Thank you, Blandine. I'd also just like to invite our speakers, please feel free to post in the chat links to the app or links to your website so our participants can go and explore those sites. Our next question is for Vinicius from Data Labe and Pupusapp. Vinicius, does Pupusapp have any relationships with local media who also use the data that you guys have been producing and gathering with Pupusapp?
Yes, we do. We have a very strong connection with Data Lab, of course, and Data Lab itself has a very strong journalistic side, so they produce a lot of journalistic pieces. But we also have a close relationship with local medias from the favelas in Brazil, because a lot of favelas have people like us or people who produces stories and journalistic pieces about these favelas, these different favelas. So we see mostly this info exchange, let's put it this way, being used in this with some bigger Brazilian journalistic websites and so on. So yes.
That's great. That's amazing. And our last question, we're just running a bit short on time, is for Lisbeth with Radha app. Lisbeth, how difficult was it for the initiatives to pivot to these secondary engagement channels, or were they part of your plans from the beginning?
Repeat the question again, kindly.
So this question is from one of our internewsers. So we've seen multiple cases of a technology, whether it's an app or a website, that's paired with other outreach approaches like the virtual counseling services that Radha app has to offer. So how difficult was it for these initiatives to pivot to these secondary engagement channels, or were they part of your plans from the beginning?
Okay, as I said again, we did this work with the students, and that was for the ownership and for them to feel that they have contributed to the development of the application. And then what we did again, our students are used to our university counselors. They know very well that they pay school fees in addition to their health services. And they felt that this is an opportunity to utilize anonymously the services that they never go to seek in the university health service facilities. So it was very easy for us, and then we worked also as a team. As we were developing the content, we would put the students together with the university service providers together. So the students did not feel like this would be a problem, again, because even the promotion activities are done by the students. I don't know whether I've been able to answer.
I think you have. So I think, in essence, the need for these secondary sources of engagement had arisen directly as a result of the students' needs, responding to your audience.
Yes, yes.
Wonderful. We've got about 3 minutes left. I'm going to hand back over to my colleague Bea just to wrap us up. Thank you so much to all of our speakers, and thank you so much to our participants. Bea, back to you.
Thank you so much, Catherine. Thank you, everyone, for making time this morning to meet some of our Health Journalism Network members. We are very proud of the work they're doing, and I hope also that they learn from one another. That's the goal of the network, to connect them together and to create new collaboration and partnerships. So stay tuned. If you're not already registered for the Health Journalism Network, my colleague Michael is going to drop the link again, and sign up so that you can stay in touch with us via the newsletter, monthly newsletter, and soon we will have web pages launched in the Internews website. So thank you, everyone. Thank you, all the presenters, and we'll be in touch via email with you all. Have a great rest of the day.
Thank you, Bea.
Great day. Thanks, Bea.
Thank you.
Thank you, everyone.
Thank you very much. Very much.
Thank you.
Thank you, Tole.
Thank you. Have a
Thank
good
you,
rest of the day.
Christoph and Michael. Bye, guys. Hi, Gideon. Nice to see you.